Hello everyone, I'm Dr. Sakamoto. Thank you for watching. Today, I will talk about rotator cuff injury. Before talking about the rotator cuff injury, I will explain about the anatomy of the shoulder. This model presents the front view of the right shoulder joint. This is a collarbone. This is an arm bone called humerus. A bit hard to see, but this small muscle running through the end of the humerus is called supraspinatus. This forms the rotator cuff. This rotator cuff is responsible for starting to lift your arm. So, it is an important muscle. It's called a complete tear when this part is entirely torn apart, and a partial tear when it is damaged somewhat but not completely ruptured. These are the two types of rotator cuff injury. The causes of rotator cuff injury are falling on an outstretched hand, twisting the shoulder in sport activities, and degeneration of the rotator cuff by age, which suddenly prevents raising the arm. As a characteristic symptom, the arm can reach upwards only this much, but when partially torn and not completely separated, you can manage to raise your arm. Since you can lift the arm but have shoulder pain when moving a little, a rotator cuff injury can often be mistaken as a frozen shoulder. The frozen shoulder and the partial tear of the rotator cuff have similar symptoms. You can check my other video for a frozen shoulder. A frozen shoulder does not display tears on the rotator cuff, but shoulder muscles tighten up with age, usually in the 40s and 50s, lead to gradual loss of movement, which results in the shoulder pain. Contrarily, the partial tear on the rotator cuff is caused by torn tendon, resulting in pain when moving the shoulder. These two diseases are not the same at all. To diagnose a rotator cuff injury, MRI and ultrasound scans are often used. These tests can see the details and determine a partial or complete tear. For treatment of a rotator cuff injury, if the tear is partial and with relatively mild pain, conservative management is usually adopted, and we monitor the pain for about half a year with injections and rehabilitation. If the pain does not improve after half a year, we may decide on arthroscopic surgery. But in cases of a complete tear, the arm cannot reach even to 90 degrees. We would then perform a surgery immediately. The surgery for rotary cuff injury uses endoscopes. We make a few small cuts and insert a camera. While looking at the camera images, we stitch up the torn parts. Or if it's a big rupture like a hole, we often stitch it together with a patch. The rehabilitation after the surgery to the rotator cuff on the shoulder can be taxing. The arm must not be let down, and a brace is placed here. For about 2 months, the patients must wear the brace and spend time in this level position. This is a negative aspect of the surgery. After the surgery, keeping the arm in this position for 2 months makes it hard to maintain a normal life. Recent stem cell therapy using one's own cells does not require such a brace. By culturing one's own cells and injecting them into the shoulder, the regeneration of the rotator cuff will be achieved. It is possible to have a normal life during this reparation period. The stem cell therapy for rotator cuff injury begins by drawing out stem cells from your body, then growing the number of the cells. These cells will then become nerves, vessels, muscles, and tendons, etc. Just injecting these stem cells in the shoulder repairs the ruptured tendon, which makes it possible to raise the arm again. Although it takes a few months to complete the therapy, you can continue to live a normal life. It is much easier than the conventional surgery. This stem cell therapy may be effective with just one injection, but depending on the patient, 2 or 3 injections may be needed. Let me explain about a patient who tried stem cell therapy for rotator cuff injury. The patient was in her 60s when she visited our clinic. At a different clinic, MRI detected her injury on the rotator cuff, but her shoulder pain continued on for more than half a year, and she had a hard time raising her arm. She was told that surgery was necessary to fix her shoulder, but she was hesitant about an operation and began looking for alternative treatment. She then came to our clinic to try stem cell therapy, telling us that she would have an operation if her therapy did not heal her shoulder. In the first 3 months, the pain started to disappear. In 6 months, her shoulder, which used to be painful when lifting the arm only this much, could now move freely. Realizing that a rotator cuff injury can be healed so well by stem cell therapy made me happily surprised. Until now, the only treatment for rotator cuff injury was conservative management, and then arthroscopic surgery if the pain remained. Stem cell therapy provided an option to avoid an invasive treatment, but achieved almost the same results as a successful surgery. I think it is a great news that we now have more options by adding this new therapy to the conventional treatments. In our clinic, we recommend that rotator cuff injury patients try stem cell therapy. Today, I have explained about rotator cuff injury. If you want to know more or have questions, please write any comment below, and I will answer them. Thank you for watching.